Good afternoon, folks. My name is Chris Skizak. I am the Executive Director of Texas Employers for Affordable Healthcare, also Executive Director of the Houston Business Coalition on Health. Mary Ann Faison will talk about that connection between TBGH and other coalitions in a moment. But we're pleased to have you join us. We will have folks coming online in the next minute or so. But today's topic is why employers are paying more and getting less. And we're proud to feature Chris Deacon, a friend and colleague, who is the author of The Great American Healthcare Heist. Just one a summary of Texas employers. We're a 501 C4 nonprofit, mobilizing employers, families, and employers across the state to rein in the excessive prices paid for employer-sponsored health care. So we're pleased. Folks are arriving, and we'll have a good crowd here. So go to the next slide, and Mary Ann, you can talk
Chris.
about what we're about.
Good afternoon, everyone. I'm Mary Ann Faison. I'm the president and CEO of the Texas Business Group on Health, which is partnering with the Texas Employers for Affordable Health Care. In fact, it's one of the arms, if we would call it, of our Texas Business Group on Health, which is a nonprofit educational statewide business educational association dedicated to promoting healthcare quality, innovation, accountability, and value for employers across the state. And it's also to help their employees obtain affordable care, accessible and affordable and high quality. And I have to just mention, if you don't already know this, that affordability is the number one concern of the Texas employers and employers across the country and of their employees as well. And so we have a tremendous opportunity to work with the program today, especially to talk about the affordability issues that the companies and the employees are facing. So the Texas Business Group on Health has three member coalitions, and we're about to have a new one join us. The Dallas-Fort Worth Business Group on Health, the Houston Business Group on Health in the different areas, San Antonio Business Group on Health, and possibly soon will be the Austin Business Group on Health as another partner. And we're also all members of the National Alliance of Healthcare Purchaser Coalitions, which has about 50 coalitions across the country in almost every state of the country. So we all work together. The next slide, I just wanted to point out some of the Texas programs that are in progress coming up. And one of them is the Houston Business Group on Health Coalition holding its winter forum on building a transparent and cost-effective drug spend strategy. Employers are complimentary to attend the program. You have the link available for you that you can click on. And 2 days, December 3rd and 4th, in Houston, if you want to go in person, if you're from other parts of the state, this is a well-worth opportunity to really learn more about the drug spend strategy. Then the next program we have coming up after that in the Dallas-Fort Worth area is the DFW and TBGH 21st Annual Benefits Forum. This is a one-day program to be held on December 17th. And every year we choose a different theme. And this year it's Wicked Benefits. And I think that's maybe a very appropriate title for what the employers are facing in designing their benefits programs for the coming year, especially. So you are, as employers, you are invited to participate in that complimentary. Any Texas employer is available, has the opportunity to join us. One-day event. We also have opportunities if you want to spend the night there. If you click on the information for the Texas Business Group and for the DFW Business Group on Health, we can give you that information as well. So if you want to come in the night before, but it's a great gathering of almost 400 employers and employees across the state. And the next issue that we have would be Happy New Year. And I'll turn it over to Chris to introduce our Chris Deacon. We're so pleased to have you participate, Chris.
So I won't read this. You can look at this yourself, but I met Chris probably 6, 7 years ago at a National Alliance event. And I can say that Chris has a national reputation for being one of the leading advocates on behalf of employer purchasers. She'll talk about her experience with the state of New Jersey, but suffice to say that Chris is really one of the leaders in this country promoting and advocating at the federal and state level um, for employer purchasers. So I just have the opportunity and the pleasure to introduce Chris, who has a little bit of interesting news to share with employers before she starts talking about her book. So Chris, please speak up. This is big news if employers haven't heard it yet.
Yeah, thanks, Chris. And I do remember that meeting several years ago. And sometimes it's good to remember to look back and see how far we've come when we get discouraged. So I like to do that. And speaking of looking back, this case broke just this past week, a week ago. The state of New Jersey settled for $100 million with Horizon Blue Cross Blue Shield as a result of False Claims Act allegations involving payment of claims above billed charges. Um, there's a lot in the underlying whistleblower complaint that is not yet public. So more to discuss when that eventually becomes unsealed. Right now, it's just sort of a narrow scope of issues that that this settlement or the complaint discusses. But suffice it to say, it's been a long 4 years, long 5 years. And I'm happy to see some measure of justice being done and certainly awareness being driven. I think that that's, for me, the primary positive outcome here, in addition to getting some money for the state, but just raising awareness and the alarm bells. So more to come on the case, I'm sure, in the next few months. But I think we should, take a moment again to see this is really remarkable, and I think in some ways groundbreaking for a public sector entity to have pursued this and prevailed, I think. So, any
This
questions there,
is
Chris?
No, no, no. There's more to come. So we're just going to keep this on in the background. I'm sure several of the folks who are online will screen or scan the QR code here if you're interested in acquiring a copy of Chris's book. I read it cover to cover, highlighted notes. I mean, it is a really fantastic expose of the system we currently have, but more importantly, how we can change the system, and in particular, how employers can be active in making a difference for their organizations, and most important for their employees and their families. So I am just going to go off screen and mute myself and give Chris the opportunity to speak. I would add, if you have questions while Chris is speaking, please put them in the chat and we'll make sure that every question is answered either during or at the end of the session, depending on the question. So, Chris, it's all yours, and we're again glad you're able to share this time with us.
Thanks, Chris. I'll start by letting everybody know who doesn't already know. I actually am living in the United Kingdom now, in the northwest of England, and for my spouse's job assignment. And it's really remarkable to do some on the ground research as to how different systems work and some of the perceptions and misperceptions that we all have of sort of each other's healthcare systems. My son, when we moved here, needed to get some medication, and I've been here now a year and 3 months, and we had his appointment about 2 months ago, and we're told we would get his results in approximately 2 more months. And then if positive, we would then be able to see a specialist in approximately 55 weeks. So while, they don't complain about receiving a $14,000 hospital bill or ER bill, there are certainly, there are certainly complaints and gripes over here across the pond. But, I think one of the reasons I lead with that is because I want to point out that we have a sort of a uniquely American problem. And as I said to Senator Sanders after a hearing once, when he was applauding sort of the UK's NHS system for its access and affordability, I did remind him very professionally and with great respect that we have a uniquely American problem that requires a uniquely American solution. But before we get to solutions, we have to identify the problem. And that is really why I wrote this book. There are probably dozens of books out there on pharmaceuticals and hospitals and insurance carriers and PBMs and the ACA and Medicare and you name it. But what I couldn't find when I looked is, a book that attempted to bring it all together from a systemic lens and bring it all into one frame, so to speak. It was an attempt to stop us from continuing to fall into this sort of binary debate, universal health care versus cash pay, physicians versus insurance carriers, pharma versus PBMs, left versus right. It's when we fall into that trap, I believe, land exactly where sort of the status quo industry really wants us, which is not focusing on the systems change required to fix our market, and having us focus on these individual pieces of the whole really distracts us from the root issues. So the goal here was to name the uniquely American problems, to better understand them, and then to really spread the word so that we can begin to be honest and have meaningful debate on the uniquely American solution that will be required of us all. So with that, what we're going to be covering today, again, is sort of an overview of the book and how I intended it to be used, really as a tool and not, a light vacation read. And, the webinar is intended to be sort of a level set ahead of talking about solutions in the weeks to come. So what are the strategies and the tactics? We'll talk about how to use the data field guide that I helped produce, and that I know you all have access to. We called it a field guide because we understand that you walk into battle essentially every day, whether you know it or not. And my aim here was really to equip you with both sort of the weapons and the armor in that field guide you need to accomplish your shared goals, which are, I believe, affordability and transparency and fiduciary accountability. And as we just said, high quality healthcare for all of your members. So let's see, why sort of the headline of the webinar, why do healthcare costs keep rising? Even as employers get smarter and networks get narrower and incentives get aligned, at least on paper, and employees continue to pay more out of pocket. And I think, sort of the straight up response is this system that you're buying into, to put it in very simplistic terms, makes more money when you spend more money, and it makes less money when you reduce your costs. So, I've been asked, heist, that's quite a provocative title of your book. Were you concerned about getting sued or, because it certainly carries a connotation. And, I chose the word heist in the title of this book because, of what a heist is and what a heist is defined as, which is really like an orchestrated and choreographed event where every player in that heist knows their role and focuses on their role and does it in a manner such that the heist is essentially pulled off before the victim even realizes that they have been the victim of the heist. So you know, in healthcare, we often talk about it as it's a marketplace, but in a marketplace you have a buyer, a seller, a price, and a choice. Really four fundamental things. But in employer healthcare, we have a buyer, a seller, buyer being, the purchaser of the services, so the employer here, the seller, doctors, hospitals, pharmacies, and in between, we don't have a price. We have a network constructor, a network manager, a repricer, a PBM, a broker, a GPO, several performance vendors. We have clearinghouses, sometimes a silent partner, a consultant, and 27 touch points in the financial transaction between, the money that leaves your account and actually hits the provider's account to pay for services. And when every one of them takes their cut, you get where I'm going. The pie has to get bigger, right? The cut has to grow and the spending has to grow to feed that. And each one of these players, they know their role. It's very well choreographed, often, again, sort of happening behind the scenes and before our eyes. And before we know it, everyone in that food chain has, essentially been a part of that, taking, if you will, again, without price, often without choice. And this is why costs continue to rise, and not just rise, but really compound with each new layer that we add. The financial architecture attached to healthcare requires that it be that way, that it compounds. So I think that that's really the primary reason why we are paying more and getting less. And I do believe that the critical problem facing employers and those, sort of who fill seats like mine across the country is not necessarily healthcare inflation. I think that can be somewhat of a cop-out. We call it healthcare inflation, or we call it trend. We point, premium increases. We point to this invisible, inanimate, object as a noun, trend, inflation, when in fact it's, there are things driving that, right? Trend is not just made up of something that is, deemed to be trend. There are factors underneath it that are moving, and that is where we need to exert our purchasing power and control, because that is what will control trend, or begin to control trend and impact that noun. Today, we sort of are the passive recipients of those numbers from our consultants. What are they going to bake into the premiums next year as a result of quote unquote inflation or trend? But I think we need to stop being that passive recipient and drive the trend. Perhaps drive the trend to, God willing, be negative someday, if that's not a bridge too far. So one of the reasons, again, that I think that we have largely been passive recipients of those numbers like trend and inflation is because we believe and have believed, because we've been told that we have been buying care. We've been buying healthcare services. We've been buying access to healthcare services, and we've been buying protection, right? Financial protection. But in reality, what we have been purchasing is, the right to a discount, for example, without ever knowing whether that discount actually represents value. We've been buying the right to, quote unquote, savings programs without being able to look at the claims or the contracts or the methodology that produce those savings. We've been buying the right to be forced to pay for programs labeled as cost containment and care management, fraud prevention, all without any verifiable evidence that those programs actually contain costs or manage care or prevent fraud. Again, we've been told that this is protection, it's risk management, it's network stability, hard negotiations on your behalf and turnkey administration from these players. But I believe, and I think that recent events have borne this out, and not just in New Jersey, but across the nation. Protection on paper, like protection without verification, is not protection. It's really the purchase of an empty promise, nothing more. And again, I think recent events have borne that out. Um, we have to understand who's sitting across the table from us and what the motivations are there, and whether that's a PBM or a TPA or a carrier or a point solution, or even your consultant at times, depending on how your financial incentives and alignment work. I think that just cannot be overstated. Is that, we need, trust but verify. And I would even say, like, we need to go light on the trust. Not because the folks on the other side of the table are untrustworthy, and not because the folks on the other side of the table are immoral or amoral or bad, but because the system, again, as described in the book, the system is absolutely designed to not work in your financial interests, right? So again, I'm not making judgment calls on who is across the table. What I'm asking you to do is to recognize everybody's interests, where their interests lie, and then come to the negotiation table and come to those conversations with that knowledge and the sort of backbone and tools to demand accountability and oversight. And I think that, sort of now looking forward, that's where the data field guide comes in. It's about empowering you with the right language and and when I say language, like spoken language, you need to be able to talk about these things in a manner that seems, not just seems, but that indicates your level of knowledge here. And you need to be able to know what contract terms to use to protect yourself in order to get this data and protect the data and control the data. So I think going back to why the $100 million settlement that was just announced, I think it's not remarkable because of the number. Although the number is big, and it is remarkable that, I think what's remarkable is that is one of the biggest numbers out there in terms of settlements on behalf of commercial or public sector or even government programs, because the immensity of this problem should dictate that there be a lot more numbers like that out there. But again, what's remarkable is that it confirms, I think, in black and white, what I've always suspected, and I'm sure that many of you have suspected, is that you can follow every rule, you can procure in a really, intelligent and smart way. You can put all the performance metrics in a contract you want, and sort of feel good about your self language, and still systematically overpay by tens of millions of dollars, precisely because we cannot see where that money is going. Again, the structure is optimized for the administrator's financial benefit and not for the plan sponsor's financial protection. So I think that that's the core lesson for employers. You don't need to necessarily debate whether misaligned incentives exist. We really need to ask, are those misaligned incentives actually etched and written into your contracts? And the answer for most employers today is yes. I mean, I think whether it's quietly or elegantly or out loud in bold, they are there. And they certainly are profitable for the folks on the other side of the table. So what I saw a question. I just want to address it real quick. Oh, that wasn't a question. That was a comment by Chris. Thanks, Chris. So what changes the trajectory that we're on? I'm going to eat a little crow here, because I think 3 years ago, I would have told you it was a deluge of lawsuits, like the 401k lawsuits that were transformative for the pension side of the house and financial side of the house. I think 3 years ago, I would have been on that bandwagon, and very bullish that was going to be a catalyst for change. And unfortunately, I think I stand corrected. Maybe I'll be proven wrong and or wrong again, but I don't think it's going to be a lawsuits. I don't think, despite the very, very well-intentioned efforts in DC and indeed across the country to engage in a sort of a more healthy movement with food and weight management and that sort of thing, I don't think that is going to change our trajectory. Certainly, shared saving vendors and other point solutions that are delivered to us through the carriers are not going to be our white knight. And a continued tolerance for benchmarking off of fictitious prices is not going to get us anywhere either. I think the shift comes when employers assert in writing, and again with the help of the field guide that we've prepared. The shift happens when we get data access, so full, unfiltered, real-time claims and pricing data. When I say claims and pricing data, I'm talking about the financial transactions as well that lie underneath those claims. Where is the money going? When is it coming out of my account? When is it going to the provider? Is anything being, hitting a spread in between? Without that information, I think we really start with our hands tied behind our back. Contract alignment. We need removal of clauses that reward administrators for higher unit costs, that reward administrators for letting more money out the door in the first instance, only to claw it back and call it a shared savings. Contract alignment in the sense of audit rights and not limiting your audit rights, not limiting your choice of auditors, not limiting your scope of audit. And then I think price visibility is also key. So that I think falls in, or the lesser of logic that we talked about with the Horizon case, meaning we are only ever going to pay the lesser of the billed amount, so sticker price, or the negotiated rate. So if they're negotiating on a DRG basis or some other sort of bundled payment, whichever is lower for that particular claim is the price that we want. That really was the crux of this particular settlement in the Horizon case and their alleged inability to, or unwillingness to, abide by that contract term and sort of wait to get caught and hope they could just put the money back in the cookie jar if they were caught. But I think most employers here would assume that when they contract with a third-party administrator, that they are evaluating off of discounts, right? And how aggressive their discounts and how much they're going to save with that particular vendor. There is an assumption there, rightly or wrongly, that you are getting the best price when you accept a negotiated discount. I think it would come as a shock to a lot of employers that in many instances, you are paying a markup of the sticker price, right? You are paying 2 to 3 times more than the bill itself, which is very contrary to what we are sort of told in the industry, that like, oh, the bill's just at the sticker price, nobody pays that. Well, it turns out we pay it, but often we pay it, 2 and 3-fold. One of the examples that was highlighted from New Jersey was from a couple years, or a story from a few years ago. There was a claim from New York Presbyterian sent to the plan for, the bill was around $675,000. So the sticker price from New York Presbyterian. But what ended up being paid, or at least taken out of the account, was over $2.1 million. And so when questioned, you might ask, well, why in the, would I ever pay 2.1 million on a claim on a bill that was listed at 675,000? And the response is generally, well, that was the negotiated rate. And so you ask, and this is how the conversation goes, well, why would I pay more if the bill's that amount? Aren't I losing in this deal? And the response typically is, well, in that particular instance, but from an overall aggregate perspective, you get a much greater discount as a result of us using our negotiated discounts. Therefore, you come out ahead, and you're not getting a poor deal. And, as I've pointed out in some of my writings, like this is the ultimate like economic fallacy of sort of the law of aggregates. You have to focus on a particular transaction. Like, yes, that's great that I might come out ahead overall, but we need to focus on a claim by claim basis, particularly when we're talking about being fiduciaries to the plan. We don't get to sort of just trust you that's the case. We really need to evaluate on a claim by claim basis. Again, this is why data access is so important. So I sort of put that in the bucket of like price visibility, being able to look at real prices, real financial transaction information, what's being paid, who's getting paid, when are they getting paid, and enforceable audit language in order to find that out. And then finally, I'm going to drop the F-bomb here, the fiduciary angle, like the fiduciary enforcement piece. And I'm not talking about theoretical fiduciary duty, right? I do believe that the term fiduciary has been overused. It's turned into somewhat of a sales pitch for a lot of vendors. But the fact remains that you don't buy a fiduciary, or you can't sort of export your fiduciary responsibility to vendors. Like there is no point solution. There is no vendor that can check that box for you. I mean, they can have a fiduciary validation. They can have we are a fiduciary in our name. And I think that if they truly fulfill those obligations, then fantastic. But at the end of the day, it doesn't change your responsibility as a fiduciary. And certainly you can never outsource that, regardless of what they say on paper. So, you don't solve it with sort of a vendor branded toolkit or by checking compliance boxes. The reason fiduciary duties and, the reason it's hard is because it is really, really hard to do, right? It requires asking really uncomfortable questions amongst your peers and your vendors and folks that you've been working with for many years. It requires that level of discomfort. It means pushing back against brokers and consultants, administrators, your own leadership, and even fellow trustees at times. Again, highly uncomfortable, but necessary. It means declining, solutions packaged as too complicated to explain, right? And it often means disrupting long-term relationships, whether that's, turning down the annual golf invitation or stepping out of the luxury box at, the sporting event. You have to force these conversations into daylight. And again, one of the reasons that this is so hard is because the things I just listed are very, very hard. And I think I'm not speaking out of turn when I say that often it can come with a price. And I'm not advocating everybody in the audience to, die on a sword or whatever. But I think my experience definitely can be exhibit A as to how difficult this work can be. So I just want to take a moment to acknowledge that, recognize that, and applaud those of you who are on this call learning about it and really trying to do that work in your plans. So again, the four non-negotiables, and I think after you read the book, you certainly will come out of it with these conclusions, is that data access, full, unfiltered, real-time claims and pricing information is absolutely essential. 2, contract alignment. Eliminate clauses that reward administrators for higher unit costs, right? 3, price visibility. So making sure that you're seeing the real price, you're understanding the real price, so that you know if you're paying $2.1 million for a claim that was billed at $675,000. I was trying to explain the concept using an analogy earlier to somebody that was asking about the settlement. And I think that this analogy is actually a pretty good one. You know, we all belong to these grocery store shopping club cards, right? And you often get coupons in the mail that, you know, free this, or, you know, discounted turkey at Thanksgiving. And so, you know, it would be like getting a coupon that says, you know, Thanksgiving special, 15-pound turkey for $50, right? And you take your coupon because you're like, this is a great deal. And you go to the grocery store and you make it to the turkey aisle, and lo and behold, the turkeys are only $40, right? And you say, well, I'm not going to use my coupon. That would be silly, right? I'm going to get the turkey and I'm going to take it to the checkout lane, and I'm going to rip my coupon up or put it in the trash because it has it has no value, right? It has negative value. And there's no world in which Wegmans or Acme or whomever you use is going to say, no, you're a member of our club. You have to use the coupon. Because sometimes the coupon's going to save you money. Over the course of a year, the coupons are going to save you money. So, you know, even saying it out loud sounds absolutely ludicrous and absurd, but that's exactly what we're doing when we're not, you know, purchasing smarter by having, you know, again, having eyes on the claims and knowing what you're paying and knowing if you're paying over sticker price, and then having the contract terms to actually, you know, enforce that if that's the direction you go. Before I forget, I do want to mention that I told Chris that I have a resource that I've put together for employers and consultants that will walk you through essentially what this lesser of logic is. We'll give you model contract terms should you want to implement such a clause or provision in your own contract with your carrier or TPA, either today or in your next RFP. And then also some questions that you can ask your current vendor or TPA to really get out what is the value, right? How many claims have I paid over billed, and in what amount? How much would that have saved me? Is the juice worth the squeeze? And I think usually it will be. But Chris is going to provide that resource to you, and it also has some responses to common pushback that you will get if you attempt to go down that road. So Chris said he'll share that with everybody after the webinar. Yeah, and then lastly, number 4, fourth non-negotiable here is that fiduciary enforcement, not theoretical and not aspirational, but how do I write it into the contract, and how do I enforce it through audit? And, you know, how do I make sure that I'm getting reporting that is enabling me to enforce this? Again, it's really hard, but that's why it works. The juice is worth the squeeze on that one. I do want to have some time for questions and more discussion, but to wrap it up, not with a nice bow, because I think that would be impossible. But the book, and I've intentionally not repeated and sort of summarized the book for you because I didn't want to give a book report on my own writing. But what do I want folks to get from the book, right? What was my purpose? What is my ideal sort of use case for the book, if you will? And I would say a couple of things. There's some really practical ways that I hope it can get used. And then there's sort of the broader aspirational. So practical, tactical, this can be an incredible resource, and I've heard it being used successfully for this, for internal championing. What do I mean when I say that? Often one of the most difficult things for our HR professionals is not convincing them that, Houston, we have a problem, no pun intended, but getting the HR professional and equipping them with the right information and the right messaging in order to communicate that effectively to the C-suite that are going to be required to make some of these changes. How does that communication happen? How does that internal championing happen? How does that messaging happen? And I think one of the ways that I've heard this book being used, and I'm very excited about it, is actually sharing the book with leadership. If pharmacy costs are a particular problem, earmarking that section of the book, putting a note in the margins as to what they should pay attention to. And I've heard that a few people have said that they've done that, and their leadership has come back saying that they read that section, they went on to read the whole book, and they're mad as hell but also super energized to support HR and some of the changes that they have been pushing ineffectively over the last couple years, because there was that hurdle that they weren't able to cross. I've also, again, sort of a similar vein, the book's being passed along to state leaders and legislators, and even at the federal level. I had a friend tell me that she was lobbying on the Hill with, I think, the National Alliance, and went into Rand Paul's office and actually saw the book. And they were talking about some of the topics discussed. And that really made my day. So, being able to communicate with your leaders if you're trying to lobby or share the word. And then finally, I would say it's not just for healthcare leaders. I really intentionally focused on storytelling in order to make it more relatable for sort of the average person. Because ideally, and sort of this is if I had a magic wand, what would I wish for? I would wish for somebody to read this book and then walk out into the world with a completely different lens. And what do I mean by that? I mean, when they go to a sporting event and see the name of a nonprofit health system plastered across the jersey and the luxury boxes and up on the big screen as the primary advertiser, perhaps they might question why that is, right? That's taking up a vast amount of their taxable real estate in their community. And how is it possible that they're up on that screen? Maybe I've never thought about that before. Or when I'm watching TV and I see a pharmaceutical advertisement, maybe I'm questioning, wow, yeah, they spend $6 billion a year on advertising. So maybe I'm thinking twice. Or, I'm walking down the street or driving down Route 70 in Cherry Hill, New Jersey, and I see tower after tower and outpatient surgery center after outpatient surgery center being built. We're turning old malls into ambulatory surgery centers and outpatient facilities for the hospitals. It never occurred to me, are we all getting that much sicker? I mean, all of our knees really need to be replaced that much more. Why are these buildings happening? Who's paying for these, right? Is that 30,000 premium going towards that real estate project that is being developed maybe unnecessarily? So it's, are we able to have people walk through the world with their eyes opened? Because I think once you see some of these things and understand them, you can't help but see them in the world. So that's sort of purpose, big picture goal for me in writing the book. And then, full circle today, today wasn't about solving the problem. It was about talking about some of the problem and beginning to talk about a framework for solutions. But I hope that you'll join me, and Chris, I'm sure will be all over this with sharing information, but in the next series where we actually talk about sort of hands-on brass tacks, field guide, tools, resources, sword and shield that you need in the marketplace to actually accomplish some of these things and not just talk about them. I think we say that we have a broken market, and last week I tried to coin a term, the anti-market, much like an anti-hero. Healthcare can be seen as an anti-market because of the way that it parades around as a market, but actually functions like anything but a market. You, employers, have the leverage and the financial leverage and the power and the legal authority to change it. And it's just, how do we get there? How do we empower each other and learn from each other to to change that dynamic? So I think that sort of concludes my prepared remarks, if you will, and would love to answer any questions or have any discussion that you might want.
If folks would like, they could put their questions in the chat if you have some. Um, Let me just say that the guide, I put it in the chat. We're going to have a webinar in January, February, and March. The guide's great. It's a resource for employers only right now, made possible through Texas Employers for Affordable Healthcare. Um, we hope this will encourage folks to become active in their own future value in terms of benefits design. The guide discusses why it's important, why data is important, and then the legislative and regulatory force behind knowing that it is your data, despite um, arguments to the contrary. But most important, how to get your data. Um, Here's what you send to the plan, and then they're going to come back and say this, and then you're going to come back and say that, and there's all these iterations. And then the third is really how to use the data. And there are employers across the country that have used data successfully to really provide value. Related to that, Texas Employers for Affordable Healthcare was successful in getting House Bill 711 passed in the 88th legislative session. This bans anti-competitive language between um, hospitals and health plans. So that allows, number one, access to data, but tiering is steering to value. You can't tier and steer to value if you don't have your data to be able to understand what that is. Chris, I'd ask you to to answer this question. We have lots of folks who, yeah, I have full access to my claims data. The National Alliance did a survey, Pulse of the Purchaser, and 2/3 said they have full access. The coalition leaders saw that and said that's not anywhere close to being true. Maybe spend a minute and talk about what full access to data means. Most folks, there's hundreds of fields, and most folks get 30. Enough to
Right.
question, but not enough to answer. So if you might just say, what does full access look like?
Right. I think and you're right, many people believe they're getting full access to their data because they're being told that they have full access to their data. When in fact, it's really full access to their data, caveat or, asterisk that we believe is relevant for you. Right. And I think, I'm going to go back to the example of something you can, that's something you can do with your data, but the data is what allowed me to very easily, I'm one person, to look at and manipulate an Excel sheet to say billed and paid. And they were different, right? And not to the good, right? Like not to the right, not in the right direction. And that ultimately led to, a massive amount of money for the state, right? That's something that anyone can really do if you know how to, very basically manipulate an Excel sheet. The other thing I think on data that people generally miss, and it's definitely not something that I've seen most employers, well, not most, barely any employers get, and that's the financial transaction information that sort of sits underneath the claims, right? So you have claims data, right? What are the codes and what were the reasons for the adjustments and the rest of it. And that's all very important. But what I also want to see, right, is understanding what funds came out of my account on that claim and where did those funds ultimately go and in what amount, right? Because what we know from seeing some employers' data is that the money that's taken out of the account is not always paid to the provider in the same amount. So if I'm paying a medical claim that I believe to be a $50,000 claim, but New York Presbyterian is only receiving 45,000, 30,000, or even 20,000 of that claim, I need to know that. And the only way I can get that is through very detailed financial transaction data that, again, 99.9% of employers are not getting today.
Yeah. I saw Jonathan Markert had a question. I saw his hand up here. Jonathan, if you're still there, do you want to ask your question? Unmute yourself. Jonathan, there we go.
And Chris, I didn't actually have a question. Sorry, just accidentally hit the button.
Oh, accidentally hit the button. Okay, well, that's all right. I've got another one for you then. One of our new board members, Daisy Banda, who's really engaged in all of this with BMC software. She asked the question, once you get your data, well, then who does something with it? And I think that is so important. Getting access to your data is one thing. Who does something with it is something else. And Chris will talk about this in the upcoming webinars, but I know for HBCH, and maybe we can do this through Texas employers, I would like to have a program next year. Chris doesn't know it, but an in-person program where I would have some of the leaders from around the country talking about RFPs, contracts, and data. That could be a full day discussion that would be of extreme value. And I would say employers, bring your consultants with you if we do something like this, because these are questions you should be asking them to do for you, and how to look at the data. Pricing to Medicare based on DRG and CPTs, steering to value. So we'll be talking about that.
Well, and you
Uh,
mentioned, just real quick, Chris, you mentioned RFPs and I think you can't stress the importance of that process, the RFP process here, and how to use that process to really set expectations from your vendors from the get-go. Um, what do I mean? I mean, you can't bid on my business unless you provide me data. And when I say data, I mean these fields, right? And Chris, we've included a very extensive list of fields that you should be requesting and requiring. So rather than, go through an RFP process, do your discount analysis or whatever, you select your vendor and then you decide to sit down and hammer out a contract. That's the opposite, like that's the wrong sequence of events, right?
yeah.
At the front end, what are your non-negotiables? What are your non-negotiables? Maybe it's the lesser of, maybe it's data access in a certain manner, maybe it's audit provisions, maybe it's all three. And set those expectations up front and make very clear to the vendors, you need not bid if you're unwilling to abide by these terms. And maybe you have to start a little smaller, right? But I think that front loading that instead of getting to the back end, because once you're there, like you're a captive audience, right? So yeah, RFP process. And so time that out. It might not be next year, it might be the year after. Start making your wish list. What is your contract going to look like? And start making, putting notes down on that today.
I think you mentioned this. Someone asked, "What if your TPA will either not give us our data or want to charge us tens of thousands to get the specific data?" Well, that has to do with your RFPs and your contracts. I mean, that has to
Right.
happen up front, not afterwards.
Well, I think too, though, just some other sort of like really practical advice here. I've seen this happening more recently, especially in your market with some of your more prevalent carriers. Sort of this midstream, mid-contract, mid-project demand that if you want to continue doing payment integrity services, you need to pay us, $75,000, and you're going to need to pay us a fee in order to participate in another vendor's program. Oh, and you have to participate in ours to the tune of another, several $100,000. And what do you do in that case? They're sort of in the driver's seat. They have your data. They can shut off that claims feed. And what I've seen, some employers actually start talking to each other and band together and collectively respond and exert some of the muscle that they have. And that muscle, when flexed together, can be really powerful. So again, sort of a practical solution, but it can work.
It is the power of coalitions. There's not an employer in any market that can take this on themselves. HBCH, Dallas, Fort Worth, San Antonio, it is the collective, and hopefully our organizations will collectively become more involved, because using this type of information will really serve all.
There's one question about a policy or legislative change that would accomplish what we're discussing. And I'm sure that I'm not up on all my various state legislation at the moment across all 50 states, but I know at the federal level, there is a bill, there's a Senate bill sponsored by Senators Marshall and Hickenlooper called Patients Deserve Price Tags. And the name doesn't do it justice, because it really has a very strong employer focus in making the data that we're talking about not only accessible, like mandated and accessible, but in a specified format, a specified frequency, and it can't be paywalled, right? So really important piece of legislation. I hope it gains some more traction and legs, especially while healthcare is all the rage and discussions in DC.
Yes, there's, unfortunately, I know Chris has a hard stop at 1 o'clock. So do I. So does Mary Ann. Mark, is there a way that we have the email addresses we can answer all of these questions after the fact? For instance, do carriers ever not lease their network to independent TPAs if they partake in steering based on claims data? That's an interesting question. Good question. There's a lot of good questions here. So we're going to continue this in January. We'll get that date out here soon. And we'll again, it'll be divided up in 3 sections to talk about the guide, and we'll provide some other information on the guide's availability, how to get it. If you're an employer, how you might work with your consultant once you have it, things of this sort. So we unfortunately need to wrap it up here. Mary Ann, do you have a final comment or thought?
Yes, I'm so pleased that Chris Deacon and Chris, excuse me, for bringing this program to us. This is outstanding. It's just right exactly in our line of fire for the affordability issue. Getting all the points that you made in your discussion that are in your book, and I can't wait to get my own copy of it, because I love to read books like this. And
Great read.
I also want to remind all of those who tuned in to this program that continue to stay tuned and watch for more information coming from the Texas Employers for Affordable Health Care, which is, as I said, one of our legislative arms and affordability arms of the Texas Business Group on Health. We'll keep you informed as well from the Texas Business Group on Health. And if you're in or about any of the coalition members of the TBGH, San Antonio, Houston, and DFW, you are welcome to come to our programs. We would just love to have you as guests at any of our programs. And there are a lot going on in each of these 3 coalitions. So thank you. Enjoy your Thanksgiving holiday coming up next week.
Bye, folks. Thanks, Chris.
Thank you.
Talk soon.
Bye.
Bye.
Bye.